As a human being, it is normal that we feel anxious, worried, and fearful from time to time due to the things that our complicated life can bring. Anxiety is just a part of life, and it helps us cope with stresses we may encounter. If you are in a state of anxiety, it is likely that you have experienced an anxiety attack. Anxiety attacks are a sudden surge of overwhelming fear that comes without warning and without any apparent reason, and this would usually last for no more than 10 minutes. It is far more intense than having anxiety or the feeling of being stressed out. 1 in every 75 people worldwide will experience an anxiety attack at one point in their lives. Most anxiety sufferers report fear of dying, going crazy, or losing control of emotions, as well as behavior differences. The incidents generally provoke a strong urge to escape or run away from the place where the attack begins. And they are associated with chest pain or shortness of breath and the feeling of impending doom. A person with a phobia will often experience an anxiety attack as a direct result of the hung-up trigger. These anxiety attacks are brief and quickly relieved once the trigger is removed. In the condition of chronic anxiety, one anxiety attack can usually turn into another one, leading to nervous fatigue over days. An anxiety attack has symptoms that often occur suddenly without any apparent cause. The symptoms can be a pounding heartbeat, generally faster in nature, increased sweating, dizziness, lightheadedness, nausea, difficulty breathing, tingling and/or numbness in the face, dreamlike sensations, disassociation, the perception that one is not connected to the body and time, fear of losing control and doing something embarrassing, fear of dying, feeling of impending doom, and crying. Anxiety attacks usually last for several minutes and are considered one of the most disturbing conditions that anyone can live through in everyday life. The way to understand the different symptoms of an anxiety attack is, first comes the sudden jolt of fear with less or no trigger motivation. Then this will lead to the release of adrenaline, epinephrine, which causes the supposed fight or flight response where the person's body prepares for major physical activity. This results in an increased heart rate, labored breathing or hyperventilation, and sweating. The diaphragm involved in the action of the lungs is also a muscle and it can become overly tight. When there is a continuous inferior anxiety, a person frequently works too hard when breathing. However, if there is a hyperanxiety or an anxiety attack, there is overwhelming excitement and a person may hyperventilate. Because strenuous activity hardly ever arises, the hyperventilation leads to carbon dioxide levels lowering in the lungs and then the blood, resulting to the shift in the pH of the blood, which will then lead to many of the other symptoms such as tingling or numbness, dizziness, or lightheadedness. Anxiety attacks are a serious condition, but before you start thinking if you have this condition and go running to see a doctor, stop and take a deep breath. Relax before you start having an anxiety attack, even if you actually don't have one. Don't take things too hard, for it may lead to something serious and may affect your daily routine. Take things lightly. In any case, if you think you have this condition, the first thing you should do is see a doctor. If you are diagnosed with anxiety attack conditions, appropriate medication and good counseling can make your life normal again. Otherwise, tell yourself to relax and continue to live your life to the fullest. Thank you so much for watching this video. If you liked it, please share with your friends